Welcome to This Week in Health IT News, where we take a look at the news that will impact health IT. This is another field report where we talk to leaders from health systems on the front lines. My name is Bill Russell, Healthcare CIO Coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. As you know, we've been producing a lot of shows over the last 3 weeks, and Series Healthcare has stepped up to sponsor and support This Week in Health IT. And I want to thank them for giving us the opportunity to capture and share the experience, stories, and wisdom of the industry during this crisis. If your system would like to participate in the field reports, it's really easy. Just shoot me an email at bill@thisweekinhealthit.com. Now, on to today's show. Today's conversation is with interim CIO at Twin Lakes Regional Medical Center in Leitchfield, Kentucky, Randy McCleese. Randy, welcome to the show.
Thank you. I appreciate the opportunity to talk just a little bit with you, Bill.
Well, I appreciate you taking the time. I know that these are really busy times for CIOs at this point, and I appreciate the opportunity to get a perspective of a smaller health system. So tell us a little bit about Twin Lakes Regional, and then we'll go into what you guys are doing around COVID response and preparedness.
Twin Lakes is kind of unique. I mean, it's one of the surviving community hospitals. Twin Lakes is a 75-bed independent community hospital, and as some of those sayings go, it's an hour from anywhere. We're about an hour south of Louisville, close to an hour north of Bowling Green, and an hour southeast of Owensboro. But it's a community hospital in rural west central Kentucky, providing most of the basic services that you find at a community hospital, but having to rely upon larger healthcare organizations for any of the more advanced things that go on with patients. It's fortunately one of those community hospitals that has maintained its profitability, which has been good.
Yeah, and these are trying times for community hospitals, given this situation. So give us a little context. What's the COVID situation in your area? What's the current state situation? Have they sheltered in place? Are they whatnot? And what's currently going on in your area?
From the Kentucky standpoint, the governor started relatively early in this process and making sure things got shut down and stopping movement. Of course, there's a kind of what I call a shelter-in-place order that's going on in Kentucky. If you cross the state boundaries, you have to self-isolate for 14 days. Also, all non-essential, what's being termed as non-essential businesses have been shut down. And of course, we're able to move about for such things as healthcare and some of those essential functions that have to go on. But, I've noticed traffic especially is significantly reduced. The other thing that's going on is we've seen a lot more cooperation as far as the healthcare providers themselves go and the things that are going on with the patients themselves within the state as well as within the region itself. But from the governor's standpoint, he does a daily 5 p.m. News conference to let everybody know what's going on. We compare ourselves, of course, to Tennessee because of that rivalry there and also with Indiana. And fortunately, Kentucky is significantly lower than either one of those states with the number of cases and the number of COVID deaths. So we're kind of proud of that. But yet on the other hand, too, it is restricting very much for everybody.
Yeah, absolutely. So how are you coordinating with the other hospitals, say in the region? As you say, you're an hour from everything, which means you're in a beautiful spot of the country. But if you get sick, you have to coordinate with a lot of the health systems that are about an hour away from you. So how is that coordination going?
Well, the coordination from the clinical standpoint is being handled, of course, through the physicians on up through to the CEO. And they're working through the State Hospital Association, making sure that we know where the resources are. And also, the CEO just put out an email to all the employees letting them know what the situation would be at Twin Lakes. And Twin Lakes, being the size organization it is, doesn't have all the capacity necessary to take care of some of the more severe COVID patients. So Twin Lakes has entered into an agreement with Rural Health to take those more advanced patients, and in turn, if need be, Twin Lakes would take some of the non-COVID, less severe patients from Owensboro and bring them back here to the hospital. So working in conjunction with other healthcare organizations like that is what's going on from the business standpoint itself. Now, from the IT standpoint, I've been in contact with some of my counterparts in this area. What are you guys doing getting ready for this? And how's your staff working, your IT staff as well as the staff in general? So it's just communicating via phone, and we've had to go with video conferences like this as much as we can. But it's just communicating with others.
So right now, so you're in the office. Unless you have a block, house. So, but you're actually in the office. Is your staff still in the office, or are some of them working remotely?
Well, that's interesting. I was talking to David Muntz a few days ago, and he and I were talking about it. And about 2 weeks ago, here at Twin Lakes, we have a very small IT staff compared to some of the big organizations. Yeah. And I mean, there's 10 of us total, and we're all in the same office suite. And it just kind of dawned on me a couple of weeks ago when we were sitting here talking. I'm thinking, what if one of us comes down with COVID? Then all the rest of us have to go into isolation, which means that we don't have any support for the doctors and the nurses trying to take care of patients. So some of y'all got to go home. And that's what we did immediately was we sent some staff home to work. We've got a couple that we're just saying, you're going to work at home. Therefore, if those of us in the office have to go into isolation, you're going to have to come in and work because we've got to take care of those nurses and the doctors and all the other care providers to make sure that they've got computer equipment. And, we're talking about, we may have to walk you through how to hook up a computer or to do something. We may have to do that via video with one of our technicians at home if we have to go into isolation. So we're making changes and working. It's kind of, make these changes as we go because we don't always know what we're going to need to do.
Yeah, it's interesting. With only 10 staff, it really is an all hands on deck kind of thing. If because with 10 people, that's your analytics team, it's your EHR team, it's your PACS team, it's your it's everything. It's your desktop support team, it's your phone team, your network team. I mean, it's everything. So so you don't have the luxury of sending everybody home because some of those people have to be around. That's one of the things I think that's distinct. What specific solutions have you put in place? We've heard from some of the larger health systems, massive telehealth expansion and work from home. What kind of solutions have you put in place at Twin Lakes?
Well, as quickly as we could get it in place, after the Medicare regulations kind of got relaxed for this pandemic, we got video in place for the providers to be able to see their patients. And it kind of surprised me because, I was really concerned. We were spinning our wheels a little bit because I didn't think it would happen very quickly. We did it on Wednesday. And when I was checking on Thursday morning, we had one of our providers that already had 8 patients scheduled for that Thursday, seeing them virtually. And that to me is quick turnaround. And we were doing it, we had FaceTime available to us very quickly. Then one of the providers also brought in the Doxy.me ability, and we've implemented that as well because they were familiar with it. So we did that very quickly and got them up and running very quickly. And fortunately for us, our cellular provider in the area had some older, they're not real old, but some older iPads. And we quickly got with that cellular provider, and we've got more than a dozen of those and got them into the hands of those providers very quickly so that they can see those patients virtually. And that's really helped us tremendously to keep those patients out of this facility and still be able to see them as need be.
Yeah. So Doxy is is that open source and free, or am I wrong on that?
It is HIPAA compliant. That's one of the things that we had to be sure of. It's HIPAA compliant, and it's one of the ones that's listed. So we haven't got into too much of the details other than making sure that we could do this securely enough to meet the HIPAA requirements. But yet it's easy. It's very easy for the providers to use.
Yeah, it's interesting. You guys are being really resourceful. What kind of things have you discovered, let's say, over the past 8 weeks as you've gone through this, maybe that you didn't anticipate, that you're sort of surprised to find as we move through it?
One of the things that has surprised me is the ability of the patients to be able to do this virtual visits. The demand is far greater than I anticipated it being. The providers, I knew they would do it, but I didn't know how well they would be accepting of it. They really jumped all over it. And to me, this is just something that, and from the Chime standpoint, as you know, I've been involved with Chime for years. I'm glad to see this because I don't think it's going to go away after this pandemic is over. I think we're going to see that demand both from the patients and from the providers to let us continue some form of virtual visits. I just think it's so opportunistic for us to go down the route. And the other thing
No, please go ahead.
The other thing that somewhat surprised me is administration and management understanding and realizing that far more of their people can work from home or work remotely. I won't say necessarily from home, but they can work remotely than they thought could, whether that's full-time or part-time. And I think that's going to be a staff satisfier that we're going to have to look at going down the road too, because people are going to want to do that if it's no more than part-time.
Yeah, your community, I'm just curious, telehealth is a huge satisfier. Is the average age of your community older, younger? What are you finding? Who's using telehealth?
It's primarily the older people that are using the telehealth. And unfortunately, the issues that we've run into when it comes to the older ones that are using it and are not familiar with it, in the past, had we rolled that out, they would have been able to call on their children or their grandchildren to help them. Of course, now they can't do that. Right. So there's been a little bit of having to walk them through how to do that. They want to do it, but they just don't know how. So that's been a little bit of an issue, not tremendous, because most of them are very accepting to it. And most of them, they have an Android or an iPhone, and they're familiar with video because they've done FaceTime with their grandkids or something like that in the past. So it's not all new to them, and they seem to be enjoying it. They like that they don't have to get out. And one of the things that we were looking at is because there are some nursing homes in this area of putting that capability out, so there's nursing homes too. And I think that's something I mentioned, that's going on after the pandemic. I think that's something we're going to be looking at because a lot of those patients have to be brought to the hospital that we could see if we had some kind of video right there.
Yeah, this is going to be interesting. It's going to be interesting to see how things evolve. As you said, this is a huge satisfier. If the reimbursements stay the same or similar for telehealth, it will be interesting as a CIO baking that into, the post-crisis workflow. Because, do you think your doctors and everyone are thinking, no, eventually we'll just go back to the norm, or is this going to be sort of a new norm for your medical center?
Well, I think it's going to be a new norm because I've already heard some comments that we want to continue this, and I can't blame them because, frankly, if it's scheduled correctly, they're seeing more patients. And I mentioned a few minutes ago about the 8 patients that one doctor had scheduled. Those were all within half a day. And that doctor normally doesn't see that many patients within half a day. So they're going to be able to see more patients, just quick turnover, going from one video to the next with the patients and still be able to do what they need to do.
So, Randy, what's one thing you would share with other regional medical centers, smaller rural type providers in terms of the things that you really feel like you did well and maybe that they should be looking at?
Well, one of the things is that idea that I mentioned to you earlier is if you've got a small staff, make sure that you've got some of them working remotely because if your staff on site have to go out for isolation or anything like that, then you've got to have somebody that takes care of the doctors and nurses and puts hardware in place for them to work. Because as a provider, we have to make sure we can take care of patients. That would be number one for me. And then making sure that we've got everything up to date. And one of the questions that you had sent out, and I thought was very interesting, what is the one thing you wish you had done? And one thing I wish that had happened here is we had the remote software more up to date, because we were actually in the process of updating that software, but we were about a week into a 3-week upgrade process when this all hit. And we're just this week getting that software fully functional on the upgraded version. And I wish it had been in place 2 months ago. So, making sure you get through those kinds of things quickly, especially when it comes to remote access and being able to provide that service.
Yeah. Anything specific in working with your EHR provider? Have they provided some tools for you or anything in that respect?
We've worked with the EHR provider, and we're on Meditech here. So, from that standpoint, I've learned a lot through the Muse user group and the things that other people are doing. And Meditech has offered virtual visits. We don't have that capability here through Meditech just because we're on an older version of the software, but they have offered that opportunity to us. And we use Meditech in the hospital. We use Allscripts in the clinics. So we've not taken advantage of that yet, but we may end up doing that with Meditech at some point. Just haven't made that decision yet because we're doing it through Allscripts right now.
Wow. Fantastic. Well, Randy, thank you for taking the time. I appreciate these short, even though it's only 10 minutes, I know you guys are busy, and I appreciate you taking some time out to talk with us.
Well, I appreciate the opportunity to, Bill, and if there's anything I can do to help others, I'm available to do that. Thank you.
Thanks, Randy.
That's all for this show. Special thanks to our channel sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, and Pro Talent Advisors for choosing to invest in developing the next generation of health leaders. If you want to support the fastest growing podcast in the health IT space, the best way to do that is to share it with a peer. Send an email, DM, whatever you do. You can also follow us on social media, subscribe to our YouTube channel. There's a lot of different ways you can support us, but sharing it with a peer is the best. Please check back often as we will be dropping many more shows until we flatten the curve across the country. Thanks for listening. That's all for now.